A very, very special welcome to the Honourable Sylvia Jones, Deputy Premier and Minister of Health. We are pleased to have you here today at the University of Toronto's Discovery Pharmacy, our fully operational, accredited pharmacy serving the University of Toronto community. The mission of Discovery Pharmacy is to provide excellent care while advancing education and research on healthcare innovation. In hands-on environments like this, pharmacy and the many other excellent pharmacy sites across our province and beyond, and through our first in Canada 3-year Doctor of Pharmacy program, our faculty is equipped to train the next generation of pharmacists to meet future healthcare needs of Ontarians faster. As we've seen in recent years, pharmacists play a critical role in increasing access to primary healthcare. Our expanded scope has allowed Ontarians to receive the care they need when and where they need it, and pharmacists can do more. At the University of Toronto, we have the capacity to train more pharmacists to address the growing need for pharmacy care in Ontario in an institution that is at the forefront of pharmacy practice innovation. Our graduates are practice-ready and prepared to deliver high-quality care that meets the needs of Ontarians today and into the future. Thank you again for joining us today. It's now my pleasure to invite Minister Jones to the podium.
Thank you, Lisa, and good morning, everyone. It is great to be back here at Leslie Dan Faculty of Pharmacy at the University of Toronto, alongside Justin Bates and representatives from the Ontario Pharmacists Association, as well as Sandra Hanna from the Neighbourhood Pharmacy Association of Canada. Thank you, Lisa, Natalie, and the Faculty of Pharmacy for hosting us today, and for everything you do to provide education and training to Ontario's next generation of pharmacists. Less than 2 years ago, I was delighted to be here to share how our government was exploring more ways to expand the role of pharmacies. And today, we are continuing to build on our progress. Under the leadership of Premier Ford, our government continues to make record investments and take decisive action to protect and strengthen our healthcare system and make it easier for patients and their families to connect to more convenient care closer to home. We are building capacity across our healthcare system, including making it easier for highly skilled, regulated healthcare professionals to work to the full extent of their training and expertise. Today, I am pleased to announce our government is continuing to improve access to care by expanding the scope of practice for pharmacists and other healthcare professionals. Beginning in July of 2026, pharmacists across Ontario will be able to administer 6 additional publicly funded vaccines for eligible Ontarians, including tetanus, pertussis, diphtheria, pneumococcal, RSV, and shingles vaccines. Under the current model, these publicly funded vaccines are only available to patients through a visit to a doctor's office, a walk-in clinic, or other clinical settings. Under the new expanded scope of practice, families will now be able to receive critical vaccines more easily at thousands of additional locations across our province, with pharmacy technicians and qualified staff able to administer all eligible vaccines. I am also pleased to announce that pharmacists will be able to assess and prescribe for 9 additional common ailments, with plans to add up to an additional 5 more in early 2027, bringing the total expanded number to 33. Starting in July of 2026, pharmacists and qualified healthcare practitioners will be able to treat the following ailments: calluses and corns, dandruff, dry eye, head lice, jock itch, mild headache, nasal congestion, ringworm, and warts. This expansion to our government's previous actions to increase scope of practice, which has seen Ontario pharmacies provide care in over 2.4 million assessments for the first 19 common ailments, such as cold sores, pink eye, and UTIs. Today, over 99% of all Ontario pharmacies are now prescribing for common ailments, connecting people to care in every corner of Ontario. This historic expansion of pharmacists' scope of practice will improve access to care and reduce pressure on the healthcare system. By empowering health professionals to provide care to the full extent of their training and making pharmacies a one-step location for convenient, everyday care. In addition to these changes, our government has now officially directed Ontario's regulatory colleges for optometrists, physiotherapists, chiropractors, dental hygienists, denturists, and audiologists and speech-language pathologists to begin developing the regulatory framework that would further expand scope of practice in their fields. These future expansions will unlock additional capacity across the system by enabling professionals to deliver treatments and perform more procedures, helping people get faster access to care, while reducing wait times and easing pressure on primary care and emergency departments. Our government is delivering on our plan to make it more convenient for people to access the care they need closer to home. This is one more way we are building on our progress in healthcare and continuing to support our world-class healthcare workforce. Thank you to all the pharmacists and many other healthcare professionals for providing exceptional care to patients and their families here in Toronto and across Ontario. I will now invite Justin Bates from the Ontario Pharmacists Association to share a few words. Thank you. Stay well.
Well, good morning. It's great to be here. My name is Justin Bates, and I am the CEO of the Ontario Pharmacists Association. The Ontario Pharmacists Association is Canada's largest pharmacy-based advocacy organization and continuing professional development provider for pharmacy professionals. I would like to sincerely thank Sylvia Jones, Deputy Premier and Minister of Health, for having us here today. Minister, your leadership has been instrumental in connecting Ontarians to more timely pharmacy-led care, and we are grateful for your continued support. Pharmacies remain one of the most accessible points of care in Ontario. Located in nearly every community and open extended hours, pharmacies continue to play a critical role in keeping care close to home, particularly for those without a regular care provider. Today's announcement to expand pharmacists' scope of practice, enabling pharmacists to assess and prescribe for an additional 14 ailments, is an important milestone, reinforcing the trusted role pharmacy professionals already play within the primary care system for patients across the province. Building on the success of the Minor Ailments program, which has already connected more than 2.4 million Ontarians to timely care, the addition of services like strep throat testing will make care even more convenient. Equally important, expanding access to publicly funded vaccines in community pharmacies will reduce barriers and increase vaccination uptake by allowing Ontarians to get the care they need closer to home. Together, these advancements mark a significant step forward in improving care and ensuring Ontarians can connect to the care they need when and where they need it. Pharmacists have consistently demonstrated their ability to deliver safe, high-quality care, and this expansion reflects that proven expertise. With the right supports in place, pharmacists will continue to play an essential role in strengthening and access for patients across Ontario. On behalf of the Ontario Pharmacists Association and pharmacy professionals across the province, once again, I want to thank the Minister for your continued partnership. At OPA, we look forward to continuing to work collaboratively with your government, to continuing expanding access to care, delivering practical, patient-centered solutions for all Ontarians. Thank you. And with that, I'm going to introduce Natalie Crown. This way.
Good morning. I'm Natalie Crown, Associate Professor in the Teaching Stream and the Director of the Doctor of Pharmacy program here at the Leslie Dan Faculty of Pharmacy. As pharmacists, we actively and positively serve the benefits of our patients and society. Expanding our scope of practice only furthers this duty, and our students are ready. Our PharmD program is the only 3-year Doctor of Pharmacy program in Canada. We are actively preparing graduates to the full scope of Canadian pharmacy practice, including prescribing, assessing and developing treatment plans, and including the additional common ailments announced today. Our students are ready for the future. Our new program structure focuses on integrating pharmaceutical and clinical sciences with early exposure to hands-on learning through both simulation and real-life experience in healthcare settings. This integration supports students' learning and their ability to apply their knowledge to improve the health of the communities they serve. Our students participate in the full scope of pharmacy practice in Ontario, beginning early in their program. In fact, last November, 265 first-year PharmD students were prepared to deliver injections under the supervision of pharmacy preceptors to increase access to vaccine services ahead of the respiratory virus season. They contributed as vaccinators in Ontario's fall vaccination program. The accelerated nature of our PharmD program will help address current and projected health workforce challenges by enabling future pharmacists to enter practice 1 year sooner. We are lucky to have one of these future pharmacists here today. I'm pleased to introduce Dulain Abeyratne, a first-year student from our 3-year PharmD program, to share his experience.
Thank you, Professor Crown, Dean Dolovich, and Minister Jones. My name is Dulain Abeyratne, and I am a first-year PharmD student at the Leslie Dan Faculty of Pharmacy. I grew up in Sudbury and come from a family of physicians and nurses, so I've seen firsthand the importance of accessible healthcare in rural and northern communities. When I began considering pharmacy as a career, I realized it brought together everything I value. I wanted a profession where I could work closely with patients, apply my passion for science, and make a meaningful impact in the community that raised me. Pharmacy felt like the perfect fit. The accelerated nature of our program means I will be able to return home to Sudbury and provide care to my community sooner, while still benefiting from the incredible training opportunities here in Toronto at the University of Toronto. One of the things I value most about the program is the opportunity to learn by doing. With the support of faculty and preceptors, we can apply our learning early in our studies, which has helped me connect my training directly to patient care and health outcomes. During my rotations, I've heard from patients how much they appreciate being able to access care quickly through their pharmacist. Those experiences have reinforced for me how important an expanded scope of practice can be, especially for communities like mine back home. Thank you.
We will now begin to take questions from the media. Can all media present please line up behind me? And as a friendly reminder, the format is 1 question, 1 follow-up. Please state your name and your outlet before your question. Thank you.
Hi, Minister. Alison Jones with Canadian Press. I'm wondering if you have any hantavirus updates for us as it relates to Ontario, and in particular, the couple in Grey Bruce who are isolating. Are they still isolating? How are they doing? And have you given any thought to proactive testing for them now that we've seen this American test positive even though they're asymptomatic?
So the couple in Grey Bruce absolutely is still self-isolating. They continue to be asymptomatic, and obviously the local public health unit is monitoring closely. We do have a third individual in the Peel region who is also isolating and being monitored by the local public health unit.
Okay. And is there any testing that you're going to be doing for these individuals?
So initial conversations and feedback, knowledge from Dr. Kieran Moore suggests that testing on asymptomatic may not have the appropriate results. It may not be the best way to monitor. That's why we are that's why these 3 individuals are self-isolating, and so we can see if there are any symptoms that come forward.
Okay, thanks. And I'm just going to sneak in a third one on another topic. The Ontario Nurses Association is announcing this morning that they're launching a constitutional challenge of the law that restricts the right to strike and sends all collective bargaining just right to binding interest arbitration if there's disputes. Do you have any response to the challenge or the concerns that they raise?
So obviously they have the ability to use our court systems, and we will let the legal experts go through that. There's no doubt that the work that we've been able to do with Ontario nurses, whether it is scope of practice changes, whether it is training additional nurses, we absolutely value their partnerships and want to be there with them, but I will let the legal challenge play out.
Good morning, Jamie with City TV. The Canadian Centre for Policy Alternatives is releasing a report saying that wait times over the last 5 years has increased 52%, and budget deficits have become the new normal for Ontario hospitals. Your response to that?
Yeah, so as you know, this will be the fourth year in a row where we have invested $1.1 billion in hospital annualized operating budgets, which equates to about 4%. Last year in particular, we very much focused down to make sure that those hospitals experiencing very high deficit rates, primarily remote and rural, received an additional increase to their operating dollars. We're going to keep doing this work, but we also need to make sure that as, like I said, almost a 12% increase in the last 4 years alone, we're making sure that that money is going to frontline patient-focused care. And that's the work that we're doing with hospital CEOs to make sure that they are using best practices, that innovation that is happening in so many Ontario hospitals can be scoped and scaled to other hospitals. Using those best practices is really an important part of our regional tables so that they can share their information.
I appreciate those numbers and I appreciate how large they are, but when you look at baby boomers putting more stress on the system, inflation, and other factors, the hospitals seem to be outpaced. But the continuing report says the majority of Ontario's 136 hospitals carry an operational deficit, have been carrying an operational deficit since 2022. I understand you're putting a lot of money into the system, but it's not keeping pace according to these numbers.
Well, I think what we need to do is make sure that the money that is going into the system is actually going into that patient-focused care. You know, when I think of since Premier Ford took government in 2018, a 50% increase in hospital operating dollars. So you start to say, how can we make sure that the funds that are being flowed and are being invested into our healthcare system are actually providing that important frontline care? And, you know, things like expanded scope of practice and enhancement of vaccines has actually seen that we can take some pressure off not only the emergency departments, because people aren't only having the choice of going into an emergency department, so those lower level of intense interventions can actually be dealt with in a primary care setting or in a community pharmacy, are making an impact, and we're seeing those numbers decrease. We also saw that when we provided RSV vaccine, as an example, our pediatric ICU numbers and any risk to our pediatric surgery actually decreased, because when you offer the preventative piece, you're avoiding those hospitalizations that end up being so disruptive for not only the patients and obviously add to the hospital pressures.
Thank you, everyone. That concludes our media availability. Thanks all for attending.